Chapter 7 Supplement, Healthcare Common Procedure Coding System, aka HCPCS or HCPCS. Potato, potato, tomato, tomato, however you pronounce it, you need to know what they are. This will be a brief overview, but things that we think you should know. You will not have a HCPCS book for this chapter, but fear not, I will give you some pages out of the codebook for reference. Medications and supplies can cost a lot of money. If you are employed in a private clinic, physician's office, therapy office, or an urgent care, you need to know what HCPCS codes are and when they are used. Remember, if you don't code it, if it's not documented, you can't get paid for it. If you are working in a hospital-based facility, these codes are usually hard-coded into the charge description master, also known as the charge master. HCPCS is a set of healthcare procedure codes based on the AMA's CPT book. HCPCS contains 3 levels of codes. Level 1 is CPT, which you've already learned about. The codes are 5 characters, all numerical, such as 99070. Level 2 is referred to as the HCPCS, HCPCS, but is really the second level of the CPT code set. Codes are 5 characters, 1 alpha character followed by 4 numeric characters, such as A4590. HCPCS codes are primarily non-physician services, which can include ambulance services, prosthetic devices, medications, and supplies. Level 3 codes were considered local codes, and I say were considered because they were discontinued in 2003. These codes were the W, X, Y, and Z series in the code set. These codes are no longer included in your HCPCS books, so you can't even see what they were. I wouldn't even mention level 3 codes, however, your textbook states that some third-party payers continue to use level 3 codes. Honestly, I can't remember using them in recent history. In fact, I can't tell you when the last time was I used them. The facility in which you are employed will let you know if you need to use the level 3 codes. HCPCS also contains modifiers. They are referred to as level 2 modifiers. The modifiers are 2 position characters. They can either be both alpha characters or a combination of alphanumeric characters. HCPCS Level 2 modifiers can be used with both CPT and HCPCS codes, and they are used to modify, clarify, or further describe a service or a supply. I'm going to briefly just run through some of the most used code sections. The A codes are for ground and air ambulance services and/or medical and surgical supplies. Your E codes are for durable medical equipment, things that patients can take home with them, crutches, walkers, wheelchairs. D codes are your dental codes, and J codes are for drugs administered. The J codes are for the actual drugs themselves, not the administration of the drugs. Okay, you've got your L codes, which are for orthotics, braces, splints, and prosthetic devices. Even artificial limbs are included in here. Your V codes are for vision and hearing aids and contact lenses, and speech and language services. Okay, I hope that wasn't too awful painful, but just a glimpse into the codes that you would probably use most often. Next, we will go over how to use your HCPCS books. Y'all come back now, you hear?